so I'm Aislinn Black. I'm faculty at Rutgers, New Jersey Medical School in Newark, and I'm going to be talking about medication safety and breastfeeding, specifically in the emergency department setting. So in anatomy lab, breasts, we were told to cut them off and discard them. First 2 years of medical school, the only thing I learned about breasts was that breasts get breast cancer. Then I had a daughter. Understandably, breasts and breastfeeding had not been a big part of my residency curriculum either, so I was clearly ignorant on this topic and needed to educate myself. And one of the things I found was the frequency of advice to pump and dump. If you've never heard of this somehow, this is telling a woman to take her breast milk and instead of giving it to a baby, just pour it down the drain. Now, why is this a big deal? So no one enjoys pumping. It's awkward, it's difficult, it takes time, and if economic arguments sway you a little bit more, milk banks actually sell milk for $4 an ounce. So pumping and dumping is something we should not be routinely recommending. Here you can see that antibiotics are one area where we have many, many safe options. You can almost always find an appropriate antibiotic for your patient's condition. And our breastfeeding patients also don't have to suffer in pain. There are many safe analgesic options, especially single IV doses like we'd be doing in the department. You start to run into problems with some of those that I have in the avoid column or with very high doses or prolonged courses. Now, even our procedural sedation medications are okay. This is a graphic from our friends in anesthesiology and pain management, and you can see, even though they're a little tiny, that propofol, midazolam, even some of our RSI meds are all okay. Now, this is a pet peeve of mine, people being told after plain films to pump and dump. This is a reminder, your milk is not radioactive, your baby is not going to get superpowers from your milk after a chest x-ray. And even after a CT or an MRI with contrast, it's still fine. It's estimated that the baby after contrast CT gets about 0.04% of, so 0.01% of the dose that the mom got. With MRI, it's even less, it's like 0.0004. Now for that saddle embolus that hopefully you saw on that last CT, you might want to do some anticoagulation. And you can see here that these are actually safe in breastfeeding as well. A lot of these tend to be very large molecules that just don't pass into the breast milk. And always popular medications in the ED, all of our medications for nausea, vomiting, diarrhea, dyspepsia. Again, you have some very safe options that you can give these women. We also have people obviously coming in with colds and coughs and allergies. Just try to avoid the antihistamines and decongestants. Not that they're dangerous, so pumping and dumping is not necessary, but they dry up your nose, they can also dry up your milk. So warn your patient if you're going to do that. Now, nuclear medicine is where this gets a little bit more complicated. A HIDA scan, it's actually okay to feed immediately, but a VQ scan, you actually have to wait 13 hours, or actually you can put the milk aside and keep it. This is all about the radioisotopes used and how fast they decay, so I advise you to just look it up when you're doing one of those studies. Yeah, so keep nursing through illness, especially mastitis. Mastitis is common with breastfeeding moms, and pumping or nursing is actually therapeutic, so don't tell her to stop. And when the baby's sick, also important to keep nursing. Baby has already been exposed to whatever germs the mom has, but now the baby is actually getting those antibodies through the milk. And it's also helping keep the baby hydrated. Pedialyte's not actually superior for rehydrating babies compared to breast milk, just Pedialyte has a little bit better PR firm. So again, these are just a grab bag of other situations, our asthmatic patients, psychotic patients, diabetic patients, ectopic pregnancy even. All of these can be treated in the breastfeeding patient without telling her to stop giving the milk. So this is just saying this is an antiquated idea that we should move beyond. If you're thinking about telling your patient this, stop, say, is it really necessary? And if it is, say, is this really the best medication, or is there something else I could do? Again, a lot of information. I don't expect you or even I to memorize all of this, so there's an app, or actually two. So LactMed is actually free, but only covers medication safety and breastfeeding. The infant risk app costs $10, but covers pregnancy as well. And if you're interested in this, there are many options for learning more. I want to recommend especially, there was a recent Foamcast episode that dealt specifically about care of lactating patients, and Dr. Milk is a Facebook group and a larger group that has given me lots of support and information, and you can find us on Facebook. Thank you.
right, for our presenters, we're jumping just slightly out of order. We're going to save Can Medicine Be Funny until later, and we're going to do how to run the perfect code beyond the ACLS card next.
And quickly, really wonderful talk. Your style of speaking compared with the slides is both entertaining, but at the same time you were delivering a very original, innovative kind of message and did it in a way that makes me now want to go back and read and learn a lot more about it. So thank you.